All right, morning. This is just a quick writing correction for a synerginous. So I'll just take us through, first of all, to the writing question. That's the case note. All right, so run through the case note there. So this is a discharge letter, and I would say, yeah, it is discharge letter. So registered nurse fronting preparing Miss Jasmine Thompson discharge. Hope you can see it there. Miss Thompson has had a right replacement. She's with discharge room today with assistant from in-home nursing service. So in-home nursing service, like it's a nursing agency kind of. So those are the details. Please, when you're sending your writing, make sure you send in, a clear scanned copy of the case notes. Avoid being blurry like this. Okay. So that is the medical history. Let me just run through that. So going through the details of the patient is Jasmine age, social background, medical current, admission, medical treatment, medical progress. Can we see that? All right. And after this is where is the task now? So nursing management, physiotherapy management, discharge plan, and then now the writing task. So using the information communication, write a letter with Farah to Miss Robert, even though this patient is on discharge. So you are referring a patient to another. So it is a referral letter, not a discharge letter. We understand, but the patient is discharged from the hospital, but you are referring to in-home nursing service. Informing her of the patient's situation and requesting appropriate care. This is the address to write. So, and the instruction says, expand the relevant notes into complete sentences. Do not use note form and all that. So now let's go to this delegate's letter. Okay. So I've been able to do some correction here, which I'll just run you through. It's important that you really go through the case notes and you understand it. So put a space between the address and the dates. There's a space between the dates and the details of the patient. We misdraw something, and this is not a full stop. We use a semicolon instead before age 76. So you can put the date of birth there. Now, Miss Roberts, that's what is here. Dear Miss Roberts, okay, can you see there? Now, I want to talk about this intro paragraph. So I say that this intro paragraph, it's not complete. They have three elements that should be in the, intro paragraph. The patient, who is a patient, who is this patient, what's the presenting situation of the patient, and the third thing there is what is the purpose of the letter. So I can see here that, from what this candidate wrote, I'm writing to thank you for your care. So who underwent the replacement which has prevented her in carrying out her daily activities. Moreover, she will be discharged today with her daughter. So this does not represent a introduction. So your introduction should rather, have those three elements like I mentioned. So I wrote here that you can write, I'm writing to refer Ms. Thompson to you for appropriate care following a right shoulder replacement due to a diagnosis of right shoulder arthritis. That is the presenting situation of the patient. You want to identify the patient, you can say, I'm writing to refer Ms. Thompson, a 76-year-old, woman who, so you continue like that. Then she is now ready for discharge and will require your in-home nursing service. So that's the purpose of the letter. This introduction is complete that way. All right. You can remove this part, the daughter would say is not necessary. you can take it out from here. It could be part of the discharge plan at the latter paragraph. So talking about this second paragraph now. So generally, I advise that your second paragraph, you can make it talk about what the patient presented with in the hospital, the medical, brief of the medical background, which is relevant, and talk about the nursing management in the, a bit of the nursing management, a bit of a bit of the presenting complaint, the medical, history, medical, and a bit of social history here, because you have a lot from the case notes if you have gone through it. So put a bit of this. You can start it like Miss Thompson was admitted on the, put the date, say the date on so due to, you've already talked about it, like due to right shoulder arthritis. She was managed, with how was she managed briefly, and what is she presented so with a medical background or with a medical history of these and these and these. Patient lives alone or lives with the daughter, that's a bit of the second paragraph. All right, I need you to rewrite this letter given this guideline. Now, the third paragraph, like I've stated here as well, now you can talk about the medical nursing and the physio management. Remember, only write the most relevant one. You'll be putting in here in the fourth paragraph. And then you can have the fourth paragraph and the last that will talk about what did I put here? This discharge plan and recommendation for this patient. And you can as well, discharge plan, like this patient will require, like this part to put here, patient will require, patient has been instructed to refrain from lifting for 4 weeks and to continue. Patient has been instructed to continue to use the sling for 4 weeks and to restrain from lifting. She's to attend physiotherapy. So that's a discharge plan, usually the fourth paragraph. And any recommendation as well can go to the fourth paragraph. And you can always end by saying, yeah, if your fourth paragraph can all end by saying, if you require further, questions, do not hesitate to contact me. Or you can say, kindly continue. Let's see what the discharge plan is. So you see here, refer to assist with showering. So kindly continue to provide assistance with showering and administration of cleansing for 4 days as DVT prophylaxis. That's the discharge plan. Patient require referral to community hydrotherapy. All these are important. Follow up physiotherapy at patient. That's, you might not be able to put in everything, so just put in the most important thing. All right, and that's how to end it. I need you to rewrite this letter, just giving this correction. And most importantly, yes, make sure you put in a blank space between your paragraphs. All right, so make sure to include blank space between your paragraph. All right, so thank you very much. All the very best. Rewrite this letter and continue to write, given the guidelines. You might want to revise the last OET writing correction so that you can use clue from the corrections. Thank you very much. Well done. You're doing, this is a very good attempt for a start. So I want to encourage you to continue to write at least 2 letters a day. Write at least 2 letters a day.